Well, thank you for joining us here in Austin for the 18th Robert Lee Sutherland Seminar. It means a great deal to us that you're willing to commit your time, energy, and passion to a topic that is so important to the future of wellness and recovery in Texas and the entire nation. One of the most underutilized resources in our medical system currently is that we don't see the consumer as actually being part of the solution. And that's what recovery is able to do. It brings all those concepts together. It's respectful, it's about autonomy, it's about recognizing that part of the solution really lies in the person that's across from you.
I think this particular conference is important because it kind of pulls together a snapshot of where we are with recovery across training, research, practice.
We've introduced a new environment, a digital environment, and clinicians are spending a lot of time in it. They're spending a lot of time as they talk to us, they're at that keyboard and they're entering data. But they're entering the data that they're being asked to enter. So people are entering data about problems and deficits and symptoms, and you just simply don't see the word recovery.
Is it a feature, as Pat Deegan would put it, a feature of disruption, of innovation? And that's what we want to make sure about, right? We want to make sure it's a feature of disruption and innovation. So how do we do that if we are going into and maybe even mimicking some of the same helping relationships or helping models that we were trying to change in the first place?
And that's when I had to honestly say to myself, you know, you do want recovery.
It's very strengths-based, it's very hope-filled, it's not linear, there may be twists and turns, there's no prescribed course. It's a very responsive kind of approach to what an individual needs and wants.
Every person defines it differently, as well they should, because my experiences, my background, my culture, my perspective is different. For me, recovery is an ongoing personal growth journey that is all about learning. My recovery journey, it doesn't end, I hope. I hope it never ends.
Research now shows that we should not just be prescribing psychiatric medications indiscriminately and forever, because there are people who will do better without medication, just like there are people who will do better with medication. And that goes back again to person-centered care. Person-centered. And you have to, follow the lead of somebody like Groucho Marx, who said, if it quacks like a duck and waddles like a duck, it's probably a duck. If it's somebody who has no auditory hallucinations, no delusions, no thought disorder, no mood instability, no deficits in their daily living skills, they're married, they're working, they're living independently, they're not taking medication, they're recovered.